Welcome to the City Club of Eugene's July 16th, 2021 program, Defeating COVID, Vaccine Incentives from Coast to Coast. This is the 40th program for our 2020-21 programming year. My name's Kitty Piercy, and I'm the City Club President. Support for the City Club is provided by our members and sponsors. You can become a member, and you should, of the City Club at our website, cityclubofeugene.org. Our programs are always available on our YouTube channel and on our Facebook page, and our broadcast on public radio station KLCC 89.7 on Mondays at 7. We have both business and in-kind sponsors, including our diamond sponsors, Kaiser Permanente, University of Oregon, Peace Health, and Lane Community College, as well as generous support from the City of Eugene and from Lane County. In today's program, we welcome Kathy Kaufman, Kaufman Strategies, Craig R. Frank, Kaya Holdings, Tom Costino, Garden State Wine Growers Association, Dr. Chinwei Chi, professor at Oregon State University and founding director for OSU Center for Global Health. Biographical information on our speakers is available on our website, cityclubofeugene.org. I would like to thank Andrew Calick for coordinating today's program. So, free beer or a glass of wine, discounts on ice cream, donuts, or your favorite edibles, college scholarships for young people. Oh, and how about $1 million? These are just some of the incentives public and private sector actors are offering to encourage vaccination in Oregon and across the country, because we're seeing it really go down. And yet, despite the best efforts of public health authorities, vaccination uptake has slowed down dramatically in recent months, with many states failing to reach even 50% of eligible adults, let alone the 70% goal laid out by the Biden administration. With variants circulating and kids under 12 still waiting to be eligible for the vaccine, the fight to vaccinate more Americans remains an urgent and pressing issue. We've got an expert panel today to discuss this challenge and how government and business can continue to work together to incentivize vaccination. Our format today includes a question and answer period with City Clubs members via Zoom.
Welcome to the City Club of Eugene. My name is Andrew Calick. I'm a member of the board and the organizer of today's program. You've heard about COVID vaccines. You might have even heard that you can get a free beer if you take one, free glass of wine, maybe a college scholarship, maybe even $1 million if you're lucky enough. But even despite those incentives, we've seen vaccination uptick curb in Oregon over the last several weeks and months. In fact, there are several counties in the state that have fewer than 40% of people 16 and older vaccinated. And so the question we have today is, how do we fix that? How do we reach people who so far have chosen not to be vaccinated? And how do we incentivize them to take up what's in the interest of public health, at least according to Oregon's public health? We have a tremendous group of people to discuss this issue today. And the first person to kick things off will be Kathy Kaufman. And after our introductory statements, we will go to a question and answer session. So first, Kathy, take it away. Thank you.
Everybody. Hi, Andrew. Thanks for inviting me here today. My name is Kathy Kaufman. I am a contractor working with the Oregon Health Authority in our governor's office on COVID vaccine outreach. So let me just give you a brief overview of what kind of work the state has been doing thus far to encourage Oregonians to get their COVID vaccines. You, I'm sure, all remember what it was like in the early part of the year when the vaccines first became available. There was no problem with outreach or spreading the word because we had much higher demand than supply of vaccines for the first few months of this effort. We had people struggling to find appointments to get their shots, and so the focus was really just on making the vaccines as accessible as possible and using up every last ounce of vaccine supply that the state got from the federal government. Once supply began to increase in late spring, that changed, however, and our efforts to spread the word about vaccine availability increased. Oregon's got a number of different strategies underway, including a pretty sophisticated social media and media campaign. There's a website called safestrongoregon.org with information about the vaccines. There's information available on the Oregon Health Authority website. And there have been significant outreach efforts through hundreds of community-based organizations throughout the state who are contracting with the Oregon Health Authority to help spread the word and also to stand up local community-based vaccine sites to make getting the vaccine as easy as possible for people in the neighborhoods where they live. Once we got to about May, we saw demand for the vaccine really start to dip pretty significantly. The governor launched the Take Your Shot Oregon incentive campaign. The $1 million lottery prize winner was just announced a few days ago. A young woman who is a fine arts major at OSU was the lucky recipient, and all 36 counties in the state are also offering a smaller dollar lottery incentive for people who get vaccinated. And for youth under the age of 18, there are tuition supports being offered as their lottery incentive for vaccination. As our large mass vaccination centers in Portland, Salem, and Bend began to wind down as demand began to decrease, we also experimented with offering gift cards as an incentive. The state gave away hundreds of $100 Fred Meyer and Safeway gift cards to people for getting their first vaccination shot. And we saw that as a pretty successful effort. We saw an uptick in the number of people in those regions getting vaccinated over the previous weeks. We certainly see incentives as a critical tool in the toolbox for spreading the word about vaccines, but of course, it's not the only tool. For people who remain hesitant about getting their COVID vaccines, it's really important that their individual questions get answered. As you all may know, there's a significant amount of misinformation being spread about the COVID vaccines, what their effects are. And so part of our work is to make sure that when people have questions about the safety or the efficacy of these vaccines, we can give them factual information so that they're able to make the choice that's right for them. The state's going to continue to double down on its efforts to reach out to people who've not yet gotten vaccinated. We will be working throughout the summer and into the fall to start to do very hyper-local outreach, including direct outreach to individuals and even working with small businesses in different neighborhoods to work with them to offer incentives. Given the impact of COVID, on small businesses, we think it would be great to figure out new incentive strategies that not only encourage people to get vaccinated, but offer some support to local Oregon businesses who've been struggling because of the shutdown and the impact of COVID on all of us. Thanks, Andrew. With that, I think I will hand it off to Dr. Chinhui Chi.
Thank you, Kathy. Thank you, Andrew, for inviting me to this City Club of Eugene, this forum. My name is Junhui Ji. I'm a professor in two programs at OSU. One is Global Health Program. The other is Health Management and Policy Program. And I'm also serving as the Director of Center for Global Health at Oregon State University. And my expertise include in various dimensions of international health, in health system financing and strengthening, universal health care, and global health governance. And one kind of unique expertise I developed is pandemic, and particularly policy and control measure related to pandemic. I began to study the pandemic probably much earlier than most people in 2003. the SARS. And during that pandemic, I was followed literally every day on the development, the policy response, particularly in Asia, because Asia was the hardest hit countries. And since then, I pay attention to what happened afterwards, including the 2009, the pandemic of 2009, H1N1, even though that was disputed whether it was qualified as a pandemic. And then for the current round of the pandemic, I follow it since December, when Taiwan began to report a new disease that looked SARS-like, spread in Wuhan area. And based on what I have studied, have followed, I firmly believe this whole pandemic could have been prevented. And some of the issue I will discuss in more detail later in the Q&A sections. And in 2020, I have followed, analyzed, and compared closely, not just United States, but various countries across different continents, looking at how different countries respond in different strengths and with different results. And again, I can share with you more detail later. And of course, unfortunately, the US ended up in the 2020 being one of the worst responder in terms of national policy and response. And we contributed the largest number of cases in terms of the global cases, also the largest number of deaths. However, in 2021, because of the vaccination campaign, we are turning it around. And even though there is still room to improve, but we have seen how the vaccine has worked, that significantly reduce both the number of cases in the US as well as the number of deaths in the US. And later, I will also share with you about how we move forward toward a post-pandemic era. And right now, the key steps to move towards the post-pandemic era is vaccination. And that's the core topic we're discussing today. And that's my brief introduction. So I'll move it to Tom.
Thank you, Chinwei and Kathy and Andrew for having me as part of this forum. I'm Tom Costantino. I serve as the executive director of the Garden State Wine Growers Association in New Jersey, which is a nonprofit organization basically made up of over 50 wineries, vineyards, and associate members. We largely are the governing body for the wine industry in the state. And, you know, we were hit very hard last March at the outset of COVID. New Jersey was, you know, one of the, you know, the major hubs for the outbreak of the virus, being so close to New York City. And I unfortunately knew the first person that died in New Jersey of COVID. He was a horse trainer, and I used to work in horse racing, and I knew him from years back. And so that kind of brought things home. And also as a person who's had major heart failure in his life, you know, the outbreak of COVID and the restrictions that were placed, you know, really put me under lock and key and in fear of doing anything in public. As an industry, the wine industry was allowed to stay in operation as an essential business. But what happened is, come mid-March, all the wineries closed their tasting rooms, but we were allowed to do direct sales or curbside sales and then direct shipping to residents' homes. And that was, by being able to do that, thankfully, it kept most of our wineries afloat. One of the greatest fears that we had back in March, when it was really an unknown scenario of when we'd be able to reopen again, how bad would this get? The question was, since many of our wineries are very, very small, they're family-run businesses, we were worried that many would close. Fortunately, because of the curbside sales and those measures, they were able to make it through. And we wrote a plan for the state to open up outdoors. Because of the nature of our business, all of the wineries in New Jersey, by law, have to have 3 acres of land. And so we had ample room outside to keep people safe and in a safe environment and feeling comfortable. And so we wrote a plan for the state, and eventually we were allowed to reopen in mid-June. And our wineries followed a lot of strict protocols from the health department. And we also wrote protocols that wineries had to adhere to. And the wineries were able to navigate the summer months very, very successfully. Most of the wineries went under a reservation system, so they limited how many people were able to come in. Tasting rooms remained closed, and we were able to get through the summer into the fall. Of course, the winter months were kind of tough because without the indoors open, wineries had to adapt constantly, and many of them added fire pits and outdoor heaters and tents to just deal with the public that was looking for some place to go. And in a way, the New Jersey wine industry was the only place to be. Outdoor dining had started up again. People were going to restaurants, but people felt safe at wineries, and a lot of our wineries discovered new patrons because people discovered there were wineries in their backyard. They were coming in from New York, coming across from Philadelphia, and so the wineries had to adapt to meet the challenges of having that influx of patrons, but at the same time, they stuck to their reservations and so on. So as we've gone into the new year, and we launched mass vaccination sites in the state, they proved to be very, very successful. And the state had a goal of getting 4.7 million people vaccinated by the end of May and into June, actually. And one of the things they started to come up with to raise the ante and raise the awareness level were vaccination type promotions and incentives. And in the beverage industry, they did an agreement with the craft breweries in the state, and they called it a shot in a beer, so that anybody getting their first vaccination shot in the month of May would get a free beer at our participating craft brewery. There were about 40 breweries that participated. The reports I had were, most of the places got a few people coming in each week, showing their card and getting a free beer. The governor's office then reached out to me and asked if we would want to get involved in a similar type promotion. I had gone to my board of directors and they approved it. And we went to our membership and we wound up coming up with 9 wineries that wanted to participate. We added a 10th as we launched. And we called it Uncork the Vaccination. And the governor asked me to attend an event he did on the beach down at the shore at Island Beach State Park. It was a couple of weeks before Memorial Day. So our promotion only lasted a couple of weeks, but we announced the launch of Uncork the Vaccination. And the EPA commissioner was there as well, because one of the incentives that the state also announced was the opportunity for those that were newly vaccinated to get free entry into all the state parks over the summer months. So we participated and we looked at it as a chance to, this kind of publicity was good because it showed we were able to tell our story about how safe wineries were to be at, and the fact that we wanted people to be vaccinated because we wanted to welcome them back out into a safe environment at our wineries. So that's why we participated. My feedback from most wineries were, just like the breweries, we had a few, people coming in and out. Some people were embarrassed to show a card, didn't want to do that. But in a sense, I think it was a success because we had a lot of publicity from it. And with that, we were able to educate the public on the safety of coming to a winery, but also the importance of to come out to a winery and get back out, please get vaccinated. But now I'll turn it back to Andrew for questions.
Thank you, Tom. We actually have one more opening statement. So we're going to turn it to Craig Frank of Kaya, and then we'll turn to Q&A. So Craig, take it away. Thank you.
Okay, hi. My name is Craig Frank. Thank you to the organizers for inviting me to participate today. I run a company actually in Oregon. I'm headquartered in Florida, but our operations are there. We have 2 stores called Kaya Shack, one in Portland and one in Salem. We do have a presence in Oregon with a little warehouse, so don't think we left you guys out. We've, since our inception, have tried to figure out ways that we could be impactful on issues that cannabis itself might have a role to play. We're a cannabis company, by the way. I apologize, I didn't mention that. So a couple of years ago, we attempted to do a cannabis opioid swap program and try to introduce it into the community, and we were prevented to do so because of certain rules and regulations in the state. Since then, we had been looking for an opportunity to do something, call it in the health or wellness to our community. And when COVID presented itself and vaccinations were offered, we thought that this might be an opportunity for us to help the community, serve that role that we had initially set out to serve. And we thought the best way to do that would be to provide an incentive to get vaccinated. We don't think, we called it pot for a shot. And the Oregon state does not permit the free giving of cannabis, so we had to offer a discount instead. That discount wound up okay for the consumer because they can use it again and again and again until the epidemic is over. So some people are enjoying an extended discount. But the idea was not necessarily to convince somebody who wasn't going to get vaccinated. I don't think that would be enough of an incentive, but it was to reward those who had the community-minded approach and understood how important their getting vaccinated was to everybody else. And so we wanted to give both on the incentive side, but we also looked at it very much as a reward side. And I think so far it's gone pretty well. We have, I'd say, well over 100 customers who come in on a repeated basis using that discount. And I think others are going to start to. Certainly we hope so. And if our incentive is one of the reasons why they do, well, all the better for it.
Thank you all so much. We've seen in just those opening statements from coast to coast how there have been a variety of different incentives and efforts, public and private, sometimes both simultaneously. And so my first question has to do with the variety of those approaches, whether they're cash incentives, mandatory vaccination requirements from employers, better communication. There's all sorts of different ways people are attacking this. And so maybe Kathy, we can start with you. How did Oregon come to make the decisions it's made about how to incentivize vaccination? And how are you looking to other states and regions for guidance on what's working and what might work better?
Yeah, thanks, Andrew, for the question. So we very much looked at other states. I mean, I would say the success of lotteries in states like Ohio very much informed the approach that was taken here in Oregon. And our test of using gift cards as an incentive was really based on work that was happening both in California and Washington, and sort of seeing, you know, what the impact of a $50 gift card versus a $100 gift card might be. So we're really looking to other states. I think, you know, Oregon and other states are figuring this out as we go. And I think now that we've really come up against that hard hesitancy wall, you know, it's the need to have a really hyper local campaign is becoming clearer and clearer, because one person's reasons for not getting the vaccine yet may be really different from another person's reason. You know, so very local community and even very individually targeted efforts. You know, gift cards might work well for one person, but not for another. They might be better incentives for some communities, and other communities, who may have higher levels of mistrust in either government or the vaccines themselves, may feel like it's a bribe, not an incentive. So I think we just really need to be really sensitive to the fact that there's no one reason that people who haven't been vaccinated yet, haven't done so. And there's no one solution to help folks who haven't gotten vaccinated be willing to go ahead and get the vaccine. And I think we're really primarily thinking about those who are hesitant. So they're not a flat out resistant, absolutely not, I will never get the vaccine. I think, that population is likely a much longer term conversation.
Thank you. Chud White, from your work, have you identified certain sort of strategies or pathways that you think would be most effective in terms of increasing that vaccination rate throughout the state?
Well, as Kathy already mentioned, people who are hesitant to be vaccinated have many different reasons. And I think it's important to understand, based on statistics, and the state has the statistic, to identify which group of population have the very low vaccination rate. And I also think it's probably incomplete to categorize those who haven't been vaccinated as hesitant. If we do that, we left out a very important category. The category, unfortunately, fall largely in the minority or people of color. So there's a sizable population in this group who are not hesitant, but they have accessibility problems. For example, a large portion of this population, they are working on an hourly wage, and they cannot afford to take off from their working time to get vaccinated, because then they lose the hourly wage, and they are living from paycheck to paycheck. So for this group of people, actually, where I live, Benton County, they have done a good job. That they tried, I think by May, when they start to see the progress slowed, they start to bring the vaccine to the workplace. And one particular group that's hard to reach will be migrant workers. And this will take a concerted effort, not just at county, because migrant workers, they move around. I think the state has to be participated to identify which pocket of migrant workers have a low vaccination rate, and try to organize the vaccination team, to bring the team to the work site. And so various county has done a different job, and some of them are very effective. So for those who are working on hourly wage, it will be difficult to convince their employer to give them a paid leave in order to get vaccinated. So one strategy that can work is to identify which work site has a higher number or percentage of people who are still unvaccinated, and maybe set up by planning ahead and discuss with the employer, set up an on-site vaccination. Ideally, the vaccination should take place when the worker who are on the hourly wage can be vaccinated on site just before they're leaving the work. Because you don't want to do the vaccination before they start work or during the break, because for concern about the reaction, and that might interfere with their work. So these are just one example of reaching out. These are not necessarily hesitant, but they have accessibility problem. Also, some of these, I would not call them hardcore, but kind of semi-hardcore resistant against vaccination. We probably should not giving them up altogether, and we should at least try. For example, certain religious group or political group, one potential approach is to the opinion or political leader or religious leader, and to approach them to see to what extent they are open to the conversation, And if they're open to the conversation and we crack open the door, and that potentially through either the political leader or the religious leader, we might be able to convince some, we may not be able to convince all of them, but at least to convince some of them. And then there's the younger age group, the 12 to 18, because their vaccination campaign started late. And we need to boost up this age group. Also, given the concern about the Delta variant, the current, we have strong evidence from the clinical study that people who are vaccinated only one dose, their protection of dramatically reduced compared with previous variants. In previous study, for example, the Alpha variant, even with one dose, you still get a strong enough protection, but not for the Delta. So one group will need to boost up the vaccination in terms of population protection and herd immunity is people who have one shot, but for some reason did not get a second shot. This is also a relative low-hanging fruit that we need to catch. So
Great.
Again, I reiterate Cassie mentions, there's no one size fits all. We need to identify each group why they are either hesitant or have accessibility problems.
Excellent,
Andrew,
thank you. And
I would love to just jump off on it. I think Dr. Cheese raised a number of really good points, and I'd love to just share a little bit about current efforts connected to those.
that would be great. I'm just going to mention one statistic because the professor raised the difference between in vaccination rate. It ranges from 45% on the low end for people identifying as Hispanic or Latino to 65% for people identifying as Asian American, and there's a lot of variation in between. So just want those numbers out there. But yes, go right ahead, Kathy.
Yeah, so first and foremost, we have a pretty significant vaccine equity gap. The starkest gap exists for our Latinx population, Black, African American, African immigrant and refugee population, as well as Alaska Native American population. Their vaccine rates hover just above 40% compared to that 70% statewide rate. So a pretty significant disparity that, it absolutely is the responsibility and accountability of the state to work to address and alleviate. And I think, frankly, those populations will be, there's also a disparity for Asian populations. They're a little bit closer. It's just above 60%, but still a gap from the overall population. So I think much of our efforts, over the next few months will really focus on those communities where a vaccine equity gap exists. I think Dr. Chi is raising a number of different strategies that have been underway and will continue to be part of our effort because they are really good strategies. One, certainly migrant and seasonal farm workers and agricultural workers have been of high concern for us, and there have been state-run efforts as well as efforts through local public health agencies to bring vaccinators to migrant and seasonal farm workers to agricultural sites, and the agricultural industry has been an important partner in that effort. There's been good progress there. That work will need to continue. And then, working with faith-based leaders, is another really important strategy. And we've seen success. I mean, there's a coalition of Black pastors in North and Northeast Portland who have been actively engaged in providing information to their congregations about vaccines, as well as offering on-site vaccines in the church basement. And we've seen success, for example, in reaching out to the Latinx population by bringing mobile vaccination sites to Mass on Sunday so that, priests can speak to the value of vaccines, and then a vaccine is available for somebody who's willing to get it when Mass ends. So I think those are fantastic strategies. We have been utilizing them. We need to keep utilizing them and spread and expand them. And then, lastly, I would say employers and businesses are an important part of this equation. when there were higher levels of demand, when we had less supply and more demand of vaccine, there was a great appetite among businesses to have on-site vaccination events. And we had a number of really successful ones, especially with some of the larger businesses in the state. For example, Intel hosted on-site vaccines for their employees, as well as hosting vaccine events for the community at large. That was a great example, one of many. I think, you know, once we came up to, we got through the population that was eager to get the vaccine, demand for employer-based vaccination sites really dropped, and employers who I'd had conversations with and were really, you know, business leaders were really eager to have vaccination events, were not able to drum up enough support or willingness among their employees to make them feel like it was worth their while. I think their sense was, I had employees who wanted the vaccine, they've managed to get it by now, and now I'm left with employees who aren't vaccinated but are not ready and willing to sign up for a vaccine, even if it's held here at the employer site. So I think there's a lot more work to do there, and I think, you know, if we've got all members of community engaged in outreach, we'll be successful. Because sometimes frequently state government is not the right messenger. And, you know, local community leaders, including business leaders, I think can be really effective messengers, particularly in regions where there might be higher levels of hesitancy and or resistance. So, you know, I would encourage Eugene City Club members to, you know, especially those of you who are business owners, you know, please think about what you might be able to do to help educate your employees, answer their questions, and maybe over time convince them to be willing to get the vaccine.
I'd like to add a little something to that, if I may. That is
Go right ahead, Greg.
The role that businesses can play in this. In a state like Florida, for example, where the state government took a kind of hands-off approach, even in the phases of prevention, the local businesses were really the ones, local governments, local businesses were really the ones that took the prevention measures into their hands, obligating mask wearing and things of that nature. A lot of down to the bottom of the chain, kind of straight there with the consumer stores like ours, have relationships with their customers, are able to sometimes trusted relationships with their customers, and are able to get that message not only to our employees, but also to our customers themselves. We're a place where they're comfortable being, they're comfortable buying things. If we're saying it's kind of okay, you know, how come you're saying it? As long as we can provide information along with incentive at that level where the consumer is getting that information, I think we can also have a direct impact on moving this thing forward.
Tom, has that been your experience in New Jersey? Have your customers and your members' customers provided positive feedback on this?
Yeah, I think the positive feedback really came with the way the wineries put in the safeguards and provided the safe atmosphere, you know, over the past year. You know, with the Uncork the Vaccination promotion, giving away a free glass of wine, we only did it at 10 wineries, but it was such a short time period that you really can't, you know, have any kind of metrics to really weigh, you know, how successful it was. I think it was a success in a way of how many eyeballs we reached with all the publicity that was generated from the announcement. You know, I was on, as I said, a press conference with the governor, and I was getting texted by people seeing me on the local, you know, cable television news live with it. You know, we did get pushback from people that were trolling the governor online and, you know, ridiculing, you know, the wine industry for selling out and this and that. But I think the most important element why our wineries have thrived and are continuing to do well is that they provided the platform to educate the public on safety initiatives and what they were doing to protect those customers when they came out. And so, because now in New Jersey, there's really no mandates. It's like business as usual again. And, I think the important steps were taken over the last, since the spring of last year until now, to set up that initiative to really make the atmosphere, one, conducive to having a good time, but a safe time. And I think that's the most important thing. I think an incentive like giving away a free glass of wine for a couple of weeks, it did its job by raising the awareness level of the importance to get the vaccination.
Thank you. Our next question comes from another City Club member, Sandra Bishop. Sandra.
I appreciate all the different points of view in this forum today, and this question is mainly for Chunghui Qi. It has to do with the fact that Pfizer and I think Moderna as well are starting a conversation, a very public conversation about the possible need for a third shot, a booster shot possibility. CDC is saying, no, it's not needed. So this has to do with people that are hesitant to get the vaccine. And I want to just let you know that a lot of people who do not get flu shots do and have gotten the COVID vaccines. And they've gotten either the one Johnson & Johnson or the 2 shots. And I was very surprised that some of these people who are very hesitant to enter into this realm would actually get vaccinated. So how is this new introduction of the possibility of a booster shot requirement or a need for a booster shot going to play into the vaccine hesitant people who are on the edge, but now they're backing away because they're saying, well, no way am I getting a third shot. So if you could speak to that.
Yes, thank you, Sandra, for the questions. As you mentioned, CDC said no. At this moment, we don't know yet whether we will need a booster shot. Also, I've been looking at the medical literatures, and most recently in June and July, there are a few research published that shows very promising in terms of how long the immunity generated by the vaccine can last. And in the recent study, they found the promising outcome that the immunity will last much longer than we initially anticipated. And I think CDC is based on those newly found evidence to say, not yet. We don't know yet whether we might need a booster because the immunity is generated not just the antibody, but also the memory cell that when encounter a new variant, the memory cell will be activated and they can develop and adapt to the variant. And the memory cell lasts far longer than the antibody it generated. So that's the newly found research. And then recently, WHO also issued a concern that when the low-income country, they are barely vaccinated 1% of their population, why would rich country like United States want to talk about the third dose? And one important knowledge we learned from over 1.5 years over the pandemic is very clear. In places where the outbreak is uncontrolled, that's where we see the variant. So for example, currently the most contagious variant, the Delta, came from India. And we already identified there are 2 new variants developed in California, when California in last winter was somehow out of control. And so the very important lesson for us is not just in the country, but in the world, we are in this together. No country can be safe until every country is safe. And so there's no rush to go for the third doses. And so that's from a more global perspective.
Thank you. Our next question is from Juan Carlos. Take it away, sir.
Yes, hello, Juan Carlos Molleda, City Club board member. This is more or less a follow-up question to Sandra's point about the booster that is being discussed by the pharmaceutical companies and CDC and other institutions. So we know that this pandemic is ongoing. It's increasing in complexity. We also have learned more about not only the pandemic, but also about hesitancy, also about incentives. We know that, for instance, 5 states, the cases are increasing. Also, the death numbers are increasing. And the world is behind. Many parts of the world is behind in terms of vaccination and control of the pandemic. So my question to any one of the panelists is that, what would you say that and with everything we have learned and the complexity of this pandemic and the uncertainty for the future, especially for the fall, what would be the future strategies for incentives? Should they be given or offered in cycles or change according to location and according to population? So I would like a little bit more about the look to the future, and knowing that you have learned some so far.
I'll jump in first. I think we have to be very careful that we don't create an expectation for, what we don't want is the next time we need to vaccinate people, everybody waits because everybody knows that eventually there'll be some kind of incentive to do so. So I don't think you want to make the rewards so rich that it almost will turn into an incentive not to vaccinate down the line. But you have to make it such that the people who are remaining who have not yet gotten vaccinated, there has to be a combination of information, incentive, and availability, which is really, the fundamentals of any proper marketing effort. So once you bring it to that level, I don't know that adding to the incentive would be a smart thing to do looking too far down the road. I think we have to be careful that we don't make it such that without a lottery next time, we're not going to be able to get anybody vaccinated.
Yeah, I would add to Craig's comments. I mean, I think that's absolutely right. I mean, we, I don't envision a future in which there are incentives for everybody anytime there needs to be a vaccination. They are an effective tool in the toolbox, but they're just one tool, and they need to be used strategically and in targeted ways. In my mind, the best use of incentives is really to help folks that Dr. Chu was talking about, who don't, I mean, many of us take for granted the fact that you can go to a doctor's visit and not have to worry about taking time off work to go do it. Or if you get sick, you're going to have a paid sick day to use. That's not available to everybody, right? Some people are restaurant owners and the whole family is working in a restaurant and they can't afford to take a day off, or people who are hourly wage workers and can't afford to take a day off and have no paid sick leave. So there are pretty significant barriers for many, many people, not a small subset of the population, but a pretty significant part of the population, that make it that much harder for somebody to get a vaccine than it does for somebody who might have an office job with all kinds of benefits. So I think we need to be mindful of that. If we aren't mindful of that, we are going to exacerbate the disparities and inequities we've already got. So incentives can be a way to help counteract that. When we gave away $100 grocery store gift cards, it helped people who couldn't otherwise afford to take time off to get the vaccine and maybe need to have a sick day, be able to access it. So I think incentives as a very strategic tool are something we should keep using in a smart and effective way, especially to help us combat sort of the structural inequities that are built into our system in all kinds of ways. I think over the long haul, it's clear that COVID isn't 100% over yet. We are through this big hump of it, but we're going to be dealing with COVID for a long time to come. And ultimately, what has been revealed to us is that we can't afford to have an underfunded, inadequate public health system, and that investments into that system will help us combat this pandemic, the future pandemics that are undoubtedly going to hit us, and help us with the extreme weather conditions that it looks like will continue to be a part of our future, and that also have pretty serious health consequences.
And I can also share from a more global perspective. In late June, I just hosted and organized a big international symposium on the COVID-19. One of the biggest takeaway lesson from that symposium, we have scholars from all continents, from 18 countries. The biggest takeaway lesson related to this vaccination and incentive is, well, we can end this pandemic, and the only way to end this pandemic is mass vaccination. But at the same time, ending pandemic does not mean ending COVID-19. That we will be living with COVID-19 for a while, or we don't know for how many more years, because most experts are predicting this will become more like a flu, except the consequences more serious than flu. So here's what can be related to the incentive. We want to end this pandemic soon, because this pandemic has caused too much damage besides health and life, also economy. People lost their jobs. And the only way to end this pandemic is to have enough people vaccinated so we can lift up our fear restrictions and we can live relative normal life. But at the same time, in the post-pandemic era, we will still be living with the COVID-19. And how can we maintain safe and regular activity in the post-pandemic era to live peacefully with the COVID-19? By vaccination. Because the alternative of vaccination is to live in restriction. And we don't want that. We have enough of that restriction. So I think that will be an important incentive. And I also want to just share with you some of the incentive actually brought by business in this particular case is in big concert hall, as well as a sports event. I have read in New York and in Washington, some sports event, they begin to implement this, that people who want to participate to enter in person those big sports events, you have to have one of the two proof, either a proof of being fully vaccinated or a proof of PCR test within 24 hours that you are test negative. And I think that will be a strong incentive, but also accommodate for people who otherwise cannot be vaccinated. Because for people who can be vaccinated and hesitant, if they like to go to concert, big concert or sports event, it's very cumbersome. Every time you have to get the test within 24 hours. And it's saved a lot of time and effort to get vaccinated. So that's just one example.
All right. Thank you. We recently saw that right here in Eugene with the U.S. track and field trials at Hayward Field. So if you want to see magnificent track and field, get your shot. Last question comes from City Club member Mary Layton. Mary.
Okay. So I keep thinking about the fact that the only reason I don't speed on interstates is I don't want to get a ticket. I stop at stop signs because I don't want to hurt anybody. There's a whole bunch of other rules I follow because I can see the immediate outcome. And also, I'm very interested in the data collection around this event. So it strikes me as a golden opportunity for graduate students in public health. What works? What is the nature of the diversity in compliance? I mean, how are we going to not have this happen the next time a pandemic threatens? So I guess I'm kind of curious about what research are you aware of where we're doing a careful analysis of the nature of resistance and hesitancy and inaccessibility. Can we look for a host of papers and reports, in a few months?
Yeah, I would say the state of Oregon, as well as many other states, are doing a pretty significant amount of message testing and survey work to gauge where people are on vaccines. And we've seen it change over time. We saw higher levels of resistance and or hesitancy, in January than we do now. So it is possible for people's minds to change over time. So I think there's already a significant body of, survey and data collection that's happened throughout the country on this. I frankly, I think the New York Times has done a pretty tremendous job of reporting on vaccine hesitancy and, how people's minds are changed. I would remind us all, I'm going to take this opportunity to remind us all that at this point in the effort, it really comes down to one-on-one conversations and personal relationships. So all of you are as much a part of the vaccine outreach effort as anything the state or businesses might do. And again and again and again, what the evidence shows is that people don't want to feel like they're being looked at like they're idiots if they have questions or concerns or worries about the vaccine. There's a lot of misinformation out there. Somebody is not dumb just because they've heard it and it brings up questions in their minds. So, keep that in mind. Treat people's concerns as serious, because for them they are. They've heard this information. It's really easy for any of us to take something and not know whether or not it's real or a myth. And share what you know and encourage them, if they've got further questions, to talk to their own doctor.
Terrific. Thank you all so very much for joining us today, for all of your work to get folks vaccinated from coast to coast. If it takes a village, in this case, it takes a planet to eradicate a pandemic, and we're all grateful for your work. So for now, that's goodbye from us from the City Club of Eugene. See you next time.
This has been our July 16, 2021 program, Defeating COVID, Vaccine Incentives from Coast to Coast. Before we proceed, I'd like to introduce or recognize our diamond sponsors. Kaiser Permanente exists to provide high quality, affordable care services and to improve the health of our members and the communities we serve. More information at www.kp.org. Support comes from the University of Oregon. Since 1876, UVO has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically. More information at uoregon.edu. Peace Health is proud to serve Eugene, Lane County, and beyond. As your hometown healthcare partner for more than 80 years, our mission is to help you and your family, to keep you and your family healthy. Learn more at peacehealth.org. Lane County Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. I would also like to acknowledge one of our Sapphire sponsors, Summit Bank. Support for the City Club comes from Summit Bank, your local community bank, an independent community bank headquartered in Eugene. Summit Bank serves businesses and professionals in Eugene, Springfield, and Central Oregon communities. For more information, visit sbko.bank. And our gold sponsors, Pacific Cascade Federal Credit Union and Dr. Sandy Ibarra, Hearing Associates. Before we thank our speakers today, I have a few announcements. Thank you to our in-kind sponsors, KRVM 91.9 Radio, Pack Info and Simplified Computing LLC, Dotson's Photography, And a special thanks to public radio station KLCC FM 89.9 for airing City Club programs on Mondays at 7. We appreciate it. Our programs are always available on your YouTube channel and on our Facebook page. If you are a City Club member, you can ask a question at a future taping of our programs. It's a fun thing to do. And if you are not yet a member, you should be. You can join and then participate. More information is on our website, cityclubofueugene.org. For our program on July 23rd, we look at another important topic, affordable childcare in Lane County, with our program, Who Cares for Kids? Lane County's Child Care Desert. More details and information about future programs can be found online at the City Club's website, cityclubofuegene.org. Now I want to thank today's speakers for a great program. So thank you to Kathy Kaufman, Craig R. Frank, Tom Constantino, and Dr. Chinwei Chi. This concludes today's program. It's a beautiful day outside. Enjoy it, be well, and stay safe.